So this is our 2-week update since, and the national update since September 21st. The United States has seen an additional 609,658 cases, as well as an additional 10,278 deaths. At the state level, Kansas has seen an additional 8,749 cases in the last 2 weeks, 330 hospitalizations, 106 deaths have been recorded, but 47,666 negative tests in the last 2 weeks. Saline County-wise, we have had quite an increase. So in the last 2 weeks, we've had an additional 184 cases reported, which put us yesterday at 846 total cases since the beginning. However, you know, we've had 617 that have recovered. No change in the deaths since our last update. And right now we have 218 active cases that we are following, and many of those will probably reach that recovered status here in this next week as well. The census day is about the same, definitely in the single digits, which is good. So even though we have had a lot of cases, you know, some of the bad stuff that can come from it as far as hospitalizations and deaths has still mercifully remained low. For our county, according to KDHE's website, we have had 6,316 people tested with 5,506 negative results. One thing that doesn't include quite yet is that all of the nursing homes have had to do routine testing now, since the ruling came out from CMS, Center for Medicare and Medicaid Services, that requires all of them that are certified by Medicare to do testing. And they've been doing testing, some of them twice a week. And so KDHE, I believe, has developed a portal, which should be active now or this week, that all of those negative results that they have recorded will then be uploaded into. And so I expect in the next couple of weeks we'll see probably some significant changes in those numbers as far as number tested and then number of negative results. Our case counts. So if you look at September, to say it's been a busy month would be an understatement. We had about 300 cases in September alone. About 60 of those, though, were due to staff and residents at nursing homes that tested positive due to the new CMS testing. And for the month of September, though, we only had, I shouldn't say only, but we had 2 deaths for September. We started off October pretty busy. Friday, October 2nd, has been our highest single date of cases since this started, where we had 30 cases reported on by end of day Friday. And even though, based off of when we turn in numbers for our press releases and other things like that, we still have cases that come pouring in even after those numbers are tabulated, because there's a, you know, because of the timeline to get that stuff together, to get it for press release, to get everything else updated. And so a lot of that had just continued to pour in after. But you can see, you know, we have days where it's single digits, and then like the day before there was only 4, and then the next day there was 30. And so we really don't know, you know, what we're going to have that day as far as caseload and workload until we're in it and it's coming. So I did want to talk a little bit about some follow-up on the questions about testing that were asked last week, specifically to the couple of examples that were asked. So there were some questions about the Riley County drive-through testing. And so I looked into that, and Riley County Health Department shares a building with Konza Prairie Community Health Center, which is a federally qualified health center, pretty much like Saline Family is. And Konza Prairie runs the provides the staffing to do the testing, and then either bills insurance, or if they don't have insurance, they either use some other funds or another way to be able to pay for the test. There's still a screening process. You have to be symptomatic before you can get tested. I asked again yesterday to KDHE about the unified COVID-19 testing strategy that the governor had mentioned in her press conference last week, and that is not a document that has been finalized or published yet. So we are still waiting on that to see exactly what this strategy looks like and how it will affect Saline County. We've been asked about the rapid testing in Great Bend. So a little more research into that is that it is, again, that's conducted by an urgent care in Great Bend. The same thing as most of these others, you still have to either fill out a questionnaire, do a telephonic evaluation, and then they will determine whether you can whether it's one, to be tested, and two, whether it's the regular PCR that may take 3 to 5 days or so to get back, or whether they'll do the rapid PCR test. And the billing is essentially pretty much the same. They'll bill insurance, and if they don't have insurance, they've got some other fund or avenue that they use to try and cover that cost. Testing, of course, is just going to get more complex as we move into flu season. I know that there is some manufacturers right now who are trying to develop some dual testing platforms that will test for influenza A and B and for COVID at the same time, but they are still in development, and most of the testing cartridges or kits are still in somewhat short supply depending on what manufacturer makes your testing machine. And quite frankly, we at the health department, I don't have the capacity to try and run testing right now. Most of our staff time is focused on the case investigations and contact tracings just to keep up with that. Even with the additional staff that we have hired, as you can see, with 65 cases over the weekend, and currently staff working 6 days a week in various schedules just to keep up, that to try and add a testing strategy into that right now that we would be trying to do on our own is not quite possible. So a little bit about where to get tested, and this is why it's important, especially if you have multiple symptoms, to be evaluated by a primary care provider or evaluated by somebody. You know, this is a pretty good graphic of all the symptoms. However, combinations of those symptoms can result in a lot of different things. Fever and diarrhea could be signs of E. coli. You know, fever, chills, sore throat could be strep throat, it could be flu. I mean, the only ones that are really particular to COVID is that new loss of taste or smell. And so it's really important that somebody is at least starts with their primary care to be evaluated and make sure that they are not only being tested for the right things, but if that COVID test is negative and then they need to be further evaluated or treated, that they are appropriately treated. Another option besides primary care, CVS has started a drive-through, and that's by appointment testing. Again, you have to be symptomatic, you have to fill out a screening, and that is the link there, and it'll also be in the slides, which will be posted to our website later on today. As a reminder, we will have the flu clinic next week. It'll be October 14th at the 4-H building. This will be a drive-through clinic only for adults age 19 and older. So please wear short sleeves so that we can be able to, you know, easily get to your upper arm. Have your insurance card with you. And if you have any questions prior to that, feel free to give us a call at the health department so we can make sure that you are ready and successful when you show up for the flu clinic. And so I can't stress enough that we continue the current recommendations. wearing the mask, hand washing, social distancing, especially staying home when sick, are all proven effective measures in order to try and reduce the spread. And for us to go into, I think, any other further restrictions would not only be extremely difficult, but they would have to be very, very, I think, tight restrictions like mass gathering levels of 10 if we had to go that route in order to really be effective. And this is going to be even more important as we go into the winter months, where people start taking their events and sports indoors. So they're really going to have to be paying attention to who's around them, making that assessment for themselves too. If they go somewhere and they feel like that it's too crowded, or they don't have enough space, or somebody around them is not wearing a mask, that they may have to move to a different part of the venue that they are at. I know, just in conversation with the Tony's Pizza Event Center about a volleyball tournament that's at the end of the month. They're really, trying to make sure that all of those types of measures are in place, including capacity limits and stuff like that, so that there is plenty of room. But I don't see this getting any simpler, quite honestly, as we move into the winter months. With that, if there are questions.
Well, I'd like to make an observation, and that is that in light of everything that's going on, and the numbers and so forth, and it distresses me terribly when I drive by one of the local baseball parks this weekend and see a couple of thousand people down there that the only social distancing happened to be maybe some players that were 90 feet apart on the fields, and see all the diamonds, and the place was packed. It just leaves me shaking my head. Why do we want to continue to do those types of things and put many people at risk? So, comments from anyone else?
A quick question, Jason.
Yes, sir.
You mentioned CVS is doing testing by appointment. These private entities that do testing, do all the testing results, do they have to report back to you?
They're supposed to be reported to KDHE. And so we will then get the positive results, so that then we can be able to conduct an investigation on those. But they are supposed to, through electronic lab reporting, report all that to KDHE so that they have all of that information. Thank you.
As far as the resolution itself goes, I don't think we need a vote. I think we need a consensus of the commissioners that we need to continue with the mask. Is that appropriate, Mr. Administrator?
Yes, there's no action required until you wish to change something.
That having been said, then I would ask for a consensus from my fellow commissioners that we continue to run the mask mandate as outlined in Resolution 20-2297. Is that okay with everyone?
Yes.
Okay, we will continue with the mask mandate. So,
Yes, sir.
Thank you for the update, Jason.